Welcome to Easy Anatomy. I am continuing my lectures to cover this time the posterior abdominal wall. Posterior abdominal wall. In this section, I am going to talk about 5 muscles. The first muscle is going to be psoas major. Number 2, psoas minor. Number 3, iliacus. Number 4, quadratus lumborum. And finally, diaphragm. Okay. So the posterior abdominal wall muscles are the muscles which connect the pelvic girdle mostly with vertebral column. So if you can imagine, this is a vertebral column. Okay. Extending like lumbar vertebrae, like let us say that I'm talking about thoracic 12, lumbar 1, lumbar 2, lumbar 3, lumbar 4, lumbar 5, then we are getting here to sacral area, to the sacrum. Then we have the articulation between the sacrum, sacroiliac joint. Okay, let us imagine that this is the iliac crest and this is hip bone. Okay, and keep in mind that we have inguinal ligament down here, inguinal ligament. Okay, inguinal ligament, where we can have it as a landmark between the pelvic and abdominal region and lower extremity This is the inguinal ligament. Inguinal ligament. So this illustration, just something approximately, is not like optimum. However, just to make it easy for you to remember the outlines of each section. So when we talk about psoas major muscle, and keep in mind, let us imagine that we are talking about here the femur and the lesser trochanter. The lesser trochanter, here is the head, here is the lesser trochanter of the femur. Lesser trochanter. Okay, so basically we will find that psoas major muscle extend from the thoracic 12 and the lumbar vertebrae down here, the whole lumbar vertebrae. Okay, from thoracic 12 to lumbar vertebrae, and extend to go to the lesser trochanter. Then joined by this muscle coming from the iliac fossa is called the iliacus, from the upper 2/3 of the iliac fossa, and then joining it. That's why in the thigh we call them iliopsoas muscle. In the thigh we call them iliopsoas muscle. So we have psoas major and we have iliacus. Both of them join each other, forming the iliopsoas tendon to be inserted into the lesser trochanter of the femur. Lesser trochanter of the femur. Psoas minor muscle extend from lumbar 1 here and cover the surface of psoas major. It's on the anterior surface of the psoas major and sometimes is absent. Keep in mind that we have 6 muscles might be absent in the body. All of them start with P, with like in upper extremity there is 2 muscles like palmaris longus can be absent, and also in abdomen psoas minor and the pyramidalis might be absent, and then coming to lower extremity, you might also find another two muscles which started with P could be absent, like peroneus tertius and plantaris. So basically, keep in mind that we have 6 muscles through the whole body might be absent. All of them start with P. So psoas minor, one of them. So this is the iliopsoas muscle. The nerve supply of these muscles, they are receiving a nerve supply. If you remember, we have lumbar plexus, which is formed here, deep to psoas major and supplying psoas major in this area. This is from lumbar plexus. One of the nerves of lumbar plexus which extend lateral and enter the thigh lateral to the psoas major, this is the femoral nerve. This is the femoral nerve. So femoral nerve, okay, which extend anterior or anterolateral to the psoas major muscle. Obturator is going to be medial, which is another branch from the lumbar plexus. Femoral nerve can supply also psoas and the iliacus above the inguinal ligament. So I like to attract your attention that this femoral nerve in the thigh is superficial and it can be easily injured by stab wound or trauma, because it is crossing the femoral triangle from the base to the apex superficially, and if injury happens below the level of inguinal ligament, usually does not affect the iliopsoas muscle. So what is the function of iliopsoas? The function of iliopsoas muscle is what? Flexion of thigh. So Z flexes the thigh like this. Okay. However, if you fix the insertion, which is the lesser trochanter, Z can flex the trunk. Z flex the trunk. Okay. So Z flexes the trunk. If you fix the insertion, they flex the trunk. So they bring the trunk forward. Okay. So this is, it can be the other way around. So, or flexion of trunk or vertebral column. Okay. So this is the function. Okay. It is an, that's why, because also the close proximity of psoas major and the iliopsoas muscle to appendix, sometimes if there is appendicitis, you will find that the patient suffer of painful flexion of the thigh. If there is appendix in this area, the appendix covering in this area, and there is inflammation in this area, this inflammation creates painful flexion of the thigh because of the close proximity to iliopsoas muscle. So we're done with the iliopsoas muscle. This is 2 muscles located in the posterior abdominal wall and extended to the thigh. What is other muscles we need to know? There is another muscle in this condition. I'm extending the transverse processes of lumbar vertebrae. Okay. And if you imagine that this is the posterior part of the iliac crest, you will find that this muscle extends from the iliac crest to lumbar vertebrae, to the transverse process and the junction with the body. It is quadratus in shape. Okay. Quadratus in shape. However, also there is a ligament here. This ligament extend between the transverse process of lumbar 5 and the ilium. Okay, here This is also representing another source of the origin. It's called ilio-lumbar ligament. So the origin is going to be iliac crest and ilio-lumbar ligament. Iliac crest and ilio-lumbar ligament. And the insertion is going to be going up, is different from the psoas major, which is going down, the direction of fiber here down. Okay, it's going up to the transverse process of lumbar vertebrae. What is the function of quadratus lumborum? The function of quadratus lumborum, one side can do lateral flexion. If one side work, lateral flexion of the trunk. Okay, but if two sides simultaneously contract, they can do, if both sides, they do extension of the trunk. Extension of trunk. And usually it is covered by kidney. Okay, so this is the quadratus lumborum muscle. Quadratus lumborum muscle. Okay, so nerve supply, this muscle also is crossed by ilioinguinal and iliohypogastric, and also those are branches from lumbar plexus. So the nerve supply also is coming from lumbar plexus and ilioinguinal and iliohypogastric. Okay, so we're done with this group of muscles. Now I'm taking you to another important muscle, which is diaphragm. The diaphragm, as you know, inspiration is active process, require contraction of diaphragm. Expiration is passive process. So diaphragm, when you talk about the origin of diaphragm and insertion, we have to remember that we have, for the origin, we have, again, here is lumbar vertebrae and thoracic 12, starting from T12, and then lumbar 1, lumbar 2, and the lumbar 3. Okay, we have vertebral origin, which we call it cross, right and left cross. This vertebral origin, which coming from T12 down to lumbar 2 or sometime lumbar 3 in right side. In the right side usually is longer. This is the right cross. Okay, and the right cross is going curving around what? Around the esophageal opening. Which is located at the level of T10. This is acting like a sling-like structure at the gastroesophageal junction and participate as a sphincter. So this is the right cross. Then left cross is little shorter. Again, everything going and attached to what we call it central tendon. Central tendon is a butterfly shape like this. Okay, it's a butterfly shape. It has central part and the two sides. So this is the central tendon. Then we have, this is the vertebral origin. Then we have costal origin coming from ribs. This costal origin coming from ribs, we call it costal origin. This again sending is coming from the lower ribs So in this condition now, so far, we have like origin for diaphragm from each side, from the back, from the side, and also anteriorly, if you imagine that this pen is the sternum, there is a sternal origin from the back of the sternum. So at the end of the day, we have like vertebral origin, okay, and we have costal origin from ribs, and then we have sternal origin, and the insertion is going to be where? Is going to be central tendon. Okay, the nerve supply of the diaphragm, nerve supply is by what? Phrenic plus intercostal nerves. Okay, when you look at the diaphragm, you will find that we have three major openings related to diaphragm. The one surrounded by the right crus, this is esophageal opening. The one which located, this is at the level of T10. The one in the center here and to the right side at the level of T8, this is inferior vena cava. Then there is the arcuate ligament, or connecting the median arcuate ligament, which connect this two crura, right and left crust together. This is hiding, this one hiding aortic opening behind, aortic opening, and as you see, it is at the level of T12. Remember, 8, 10, 12, the rule of 2. So this is aortic opening, where you can see abdominal aorta coming behind it. This is esophageal opening, where you can see esophagus coming around through it. Then this one is inferior vena cava coming through it. Inferior vena cava. So we have three major openings. I like to attract your attention that each opening has three structures passing through it. Each opening has three structures. If you come from right to left, so here is the cava. Then you have aortic. Then you have esophageal. What are the three structures in each of them? The three structures in caval, inferior vena cava, that's why we call it caval. The second one is right phrenic nerve, The third thing is lymphatic, which connect, lymphatic of the liver with mediastinal lymph nodes. That's why it's easy to have metastasis from liver tumor to mediastinal. Lymphatic of the liver with mediastinal lymph nodes. Aortic has aorta, thoracic duct, and azygous vein. Esophageal has esophagus, right vagus, which now we call it posterior gastric nerve, because it descends behind the esophagus, and the left vagus, which we call it anterior gastric nerve. Okay, those are the three openings. And remember, this is at T8, this is at T10, this is at T12. Okay. How about if we say right phrenic nerve is going through cable opening? How about left phrenic nerve? So, and how about other structures coming from thorax down to abdomen? You will find, and this is something interesting you need to know, here is the transverse process of lumbar vertebrae, for example, and this is, let us say that this is the last rib number 12. You will find that we have a ligament. This ligament extends from here to here, is called the medial arcuate ligament. Then we have another ligament extended from here to here. We call it lateral arcuate ligament on each side, not only in one side. So this is lateral arcuate ligament. This is medial arcuate ligament, and this one was the median one, central one. This is the median, not medial. The muscle descend behind this is psoas major muscle. The muscle passed behind this is quadratus lumborum muscle. Okay, so this is quadratus lumborum, and this is psoas major. Quadratus lumborum, and this is psoas major muscle. But in addition to that, you have sympathetic trunk descend behind this one. Sympathetic trunk descend behind the medial one, and subcostal nerve descend behind this one. Subcostal nerve. So there is a muscle and the nerve, muscle and the nerve. The muscle behind the medial arcuate ligament is psoas major. The muscle behind the lateral arcuate ligament is quadratus. The nerve behind the medial arcuate ligament is sympathetic. And this one is subcostal nerve. I'm sorry if this piece of paper become busy, but I'm trying just to summarize everything in one page, and you can write after me, or you can read the materials from any other source once you listen to this lecture. So before I leave you, I want to attract your attention. The left phrenic again can penetrate this left crus. Right phrenic pass through inferior vena cava. Why inferior vena cava is located in the central tendon, within the central tendon itself, and why esophageal opening within the right crus? This is muscle fibers. This is what I leave you with. You see what would happen with inspiration for the venous return. Venous return, like diaphragm is contracting during respiration, during inspiration. So during inspiration, venous return increase, correct? Increase. So it means that you need to have dilation for the inferior vena cava. How you dilate vena cava here? Contraction. You see, this is the insertion. What does it mean that the insertion? It means that this is the one which is stretched towards the origin. So you see the origin on each side, back and forward, which everything attached to central tendon. But when the diaphragm, this red lines, which is muscle fiber, contract, it means stretching the tendon here, and it's like this, like that, everywhere. So stretching, it means that it expands the tendon. It means that expand this opening. It means that dilate inferior vena cava and allow increased venous return back to the heart. So why these muscle fibers, which right crus act like a sling around the esophagus, is acting like a sphincter. So this is like a sphincter to prevent the reflux. Okay, participate in preventing reflux. So this is everything about diaphragm you need to know. That the opening, the three opening, the attachment which has vertebral origin, costal origin, sternal origin, and the central tendon is the insertion. This is the insertion. Nerve supply is phrenic nerve and intercostal nerves. Action, this is the inspiratory muscle, the primary inspiratory muscle. And sometime hernia of stomach occur through the esophageal opening. And here is the stomach. There is can happen if there is any loose or relaxed muscle fibers here, or this opening is not well surrounded by the muscle, or there is any problem with the muscle here. It leads to herniation of the stomach into the thoracic cavity. Okay, I hope that this helpful for you to review the posterior abdominal wall. It's just outline. This is to trigger you to read some other materials, and good luck. The last lecture about abdominal wall is going to cover the blood and the nerve supply. Thank you very much.